Existing heart ailments, obstructive atherosclerosis, and CAD can improve and eventually resolve. In addition, you can gradually reduce and eventually eliminate your need for medications that treat high cholesterol, high blood pressure, and type 2 diabetes. This book delivers the most effective method to lose weight, lower cholesterol and high blood pressure, and reverse heart disease, and it makes most medical care and medical interventions for heart disease obsolete. Plus, the results happen quickly in most cases, immediately lowering risk and within a few months entirely removing the risk of ever having a heart attack. Over the past 25 years, I have counseled thousands of patients who've had advanced heart disease, many of whom experienced angina, chest pain, or were told they needed urgent bypass surgery or angioplasty. Not one of the individuals who followed my nutritional recommendations ever had a heart attack or died from heart disease. I do believe that the risk goes down gradually over time when a person follows such a heart protective diet style. I do not think the first week or even the first month will offer total protection against heart attacks, but as months pass, I am certain that a heart attack would be an incredibly rare occurrence. In my opinion, this life-saving book should be distributed to every heart patient in the United States because conventional care, with its usual poor outcome, is bad medicine. Cardiac patients typically worsen and usually die of heart disease despite the finest medical management. Every physician caring for people presenting with heart disease should offer them the information found in this book. Not informing patients about this simple advice that could make the difference between life and death, should be considered malpractice. Patients are not given the information they need to make a definitive decision to not have a heart attack. Many may choose to eat the heart disease-causing standard American diet, SAD, and sprinkle a few drugs on top to try to lessen the risk a bit. That's their choice. But others, and I hope this is you, will do more. They will say no to angina and heart attack. They will learn that superior nutrition can reverse and prevent heart disease and save them from getting some other diseases as well. If what I am saying is true, and if what I call a nutritarian diet style is this effective, then the foundation of traditional cardiology is subpar, even negligent. If a patient with heart disease is not told about effective dietary interventions, and instead is offered only drugs, invasive interventional procedures, and surgeries, then that person is denied informed consent. That patient has effectively been corralled into risky interventions that are expensive and high-tech, and mostly do not work. I hope that with a careful review of the information and scientific references in this book, you, working with your doctor, will help modify the way medicine is practiced. This book provides comprehensive informed consent. That means every person on high blood pressure medication or offered cholesterol-lowering drugs by their physicians should be advised to read this information first. In addition, it is critical that any patient with known atherosclerosis who is considering an intervention such as angioplasty or bypass surgery should be told that this dietary approach is a safer and more effective option. Of course, this does not include people who are in unstable or emergency situations, such as those in an emergency room having a heart attack or with unstable angina and a heart attack looming shortly. The following case history makes an important point, showing the dramatic effectiveness of this approach for heart disease. It demonstrates what I have seen routinely occur and the time frame in which individuals typically see results. Barry's story, dramatic change in 12 weeks. I went to Fort Wayne, Indiana to give a lecture to a large church group of more than 700 people. Gabby Henderson coordinated this event. She had lost more than 100 pounds following my advice and had kept the weight off for more than 4 years. She was excited about sharing my nutritarian approach with her community. She had mentioned to me in a prior email correspondence that her husband, Barry, age 53, was experiencing increasing chest pressure and shortness of breath with exertion. It had slowly worsened in intensity, to the point where he could no longer run or even walk uphill. He called his diet Fuhrman light because he still ate out almost every day, in addition to eating the healthy food Gabby prepared for them in the evening.